Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. Today, I'd like to welcome Alae Kawam. We're just meeting now, as you can tell, for the first time. Alae is a surgical pathologist. She participated in a podcast titled Wellness Initiatives That Work Inside the Lab. We connected on LinkedIn. She shared her podcast with me and asked if she could be a guest on mine. Alae said that wellness is her passion and she loves sharing her story, so I said sure. In this episode, we'll discover what drew Alae to pathology as a specialty, where her biggest pain points do and don't intersect with those of physicians who regularly interact with patients, and we'll discuss her passion for wellness. Thank you for joining us today, Alae.
Thank you so much for having me. I am super excited to be on with you.
I'm super happy to have you, and I apologize. I had a note to myself to confirm the pronunciation of your name, but we spent a couple minutes chatting about other things that I overlooked that. So
It's okay. It's funny because I joke about how, is that how you pronounce your name? Is this how you pronounce your name? I was like, in the end, it really doesn't matter. I know you're trying to be respectful, and that's all that matters to me.
Okay. All right. Well, what would you most like our audience to know about you as we begin our conversation?
Would like to be known as the person who really cares about patients, people, productivity, and obviously the most important one, well-being. I think that in a world where we look at well-being only through the lens of not being well, we really need to kind of structure things so that we can focus on wellness to prevent not wellness.
Mm-hmm. Yeah, no, that's great. Very well said. Thank you. So we could just go ahead and get started. And why don't you share your story?
So my name is so it's actually pronounced Alae, but don't worry about it.
Okay.
So I went to so I'm actually from New Jersey originally. I went to college in New Jersey and I went straight to medical school right after college. I didn't take time off, nothing. So I did college in New Jersey. I went to a small liberal arts school. Then I went to medical school. I went to a DO school in New York, and I graduated from there in 2018. Did a year of residency, and then at one hospital, another spot opened up at another hospital, and then I transferred over to finish up a pathology residency. So, I went in as a PGY1, and the second place had an opening for PGY2 because the first year had dropped out. And completed residency there, finished fellowship, and now I am working as an attending. And I have to say, during medical school, I half jokingly say this, it was the worst 4 years of my life. I can laugh about it now, but going through it, it was actually very difficult. And it was a combination of things. Bottom line, I experienced burnout. I experienced that detachment. I experienced that lack of motivation to keep pursuing my dream. I experienced what it felt like to be away from people. And I think the biggest factor that I think would have prevented my burnout was connection, human connection.
Mm-hmm.
And it was so many different factors. So while I was in medical school, obviously most people in medical school want to become your average clinician, whether it's primary care, surgery, OBGYN, psychiatry, they want to connect with patients. And I did too. However, it just felt like I wasn't connecting with my colleagues because I didn't know yet, but I was a pathologist. I wanted to sit with specimens in the sense that I was more curious to find answers to diagnoses, like, oh, what's going on here? To me, that was much more fulfilling than talking to a patient directly. So I was a pathologist. It took me time to discover that I was a pathologist. And I would say by the end of second year, which is when I burnt out, was kind of when that discovery happened, which was, I was interested in the course. It felt like a science because pathology is the study of disease. So for me to be able to understand disease processes and to be able to give people answers when they didn't know what the answer was or what's going on, that was extreme fulfillment for me. So being able to connect with people who had that same idea, like in the sense of fulfillment comes from finding that answer, and that connective piece, I think, was the missing link. Most of my colleagues were clinicians. They found fulfillment in other ways, which is to connect with, the patient directly. And everybody's different. Fulfillment for different people is different. So that, it took me time to discover that. The other thing I think was obviously the workload and the demand of medical school was a huge factor. Your weekends are spent studying. Your weekends, and every other week or 2 weeks or whatever it is, there's a test. So you're studying like anywhere between 6 to 12 hours a day. And you literally have no time for anything else. So you got to pick and choose. It's like, do I eat? Do I sleep? Do I hang out with people? Eating and sleeping are hard to sacrifice, and some people do sacrifice the sleep. And hanging out with people was the thing that took the toll with me. So I lived about an hour from my family. I had my own apartment. So, and like I said, I didn't really connect with my colleagues, my medical school classmates. So it was very hard for me to have any connection, because the only people that were actually there for me was my family, and they were an hour away, and I couldn't always visit them. So I basically disconnected from people. So when there was no connection, I was unfortunately by myself a lot and very isolated. And when you're isolated, you get stuck in your own thoughts, and that's dangerous.
100%.
It's dangerous, and you start thinking like, oh my God, what's the point? Why? Who cares? Doesn't matter to anyone anyway. I'm just a cog in a wheel. And I think that's what a lot of physicians experience, is like they get disconnected from the people around them, their sense of purpose, and then they start to question things, and that's when it becomes really dangerous. So I disconnected from people, and I had no support essentially. And it's cute because I remember the medical school trying to assign you a mentor, and it was like, well, mentorship isn't really assigned. It's more like somebody you mesh with, who understands your vision, who understands your goals. And just to be a part of that, like to advocate for you, to mentor you, to guide you, I think is something that you can't really assign. It was a cute attempt. And I think a lot of these medical schools, they have these cute attempts, but the reality is like there is more of a natural process. You do want to nurture that connection with people. So I always advocate connection with people is one of the things that will prevent burnout. But in any case, medical school was a very difficult time for me. And I think the biggest thing that led to my burnout was lack of connection, because I was always studying. I was far away from my support system. And it was just a lot of newness, where the old ways of studying, there was a lot of figuring things out. So a lot of the pressure of medical school just kind of forced me to disconnect, unfortunately.
Yeah, I've heard some people discuss that also when they became new attendings, like they might have felt that they had a built-in network in medical school or in residency, but then that's dropped when they become a new attending. So I think it could hit different people at any point in their career, really.
Yeah. And it's interesting because like when you're like a new attending, you do spend more time at work. It's like a new job. You just need to put yourself a little bit more in the realm, be a little bit more present. And that's true. And it's very difficult to balance. And that's why your first job is always your first job, right? It's hard, it's challenging, it's a lot of newness. Again, it's a lot of newness. You have to dedicate more to it because you're learning new things. And the more time you spend in one thing is less time that you're spending in another. So the more time you are around, work and whatever, you're spending less time around family. You're spending less time around the things that give you joy or a second sense of fulfillment. And I think a lot of physicians fall into this trap where we attach our identities to our physician-ness, where I'm a doctor. Yes, I am a doctor.
Right.
That's great. But I'm not only a doctor.
Right.
And I think like it really does take because it takes so much of, literally life years, day to day, daily time. It's such a big time commitment that you do kind of get enmeshed in that identity. However, I think it's important to kind of look at yourself and say, okay, if I just took away the doctor, what's left? And to find fulfillment in what's left. And I do feel fulfilled as a physician, even if it's something small, like a tubular adenoma, which is like one of these like polyps in the colon, for example. It's a very simple diagnosis, but you earn that person the proper surveillance to prevent colon cancer.
Right.
simple diagnosis, very easy. There's like, we get these cases all the time, it's very simple, but at the same time, to not get bogged down in how stupid the diagnosis is, but how meaningful it is to that person. Like, okay, that person's now going to get the appropriate surveillance.
Uh-huh.
I kind of look back at that way. The other thing that a lot of people get, so basically tying down your identity to your physicianness, and that your ultimate fulfillment or your ultimate purpose is that, can be detrimental.
Right, absolutely. No matter where you are in your career, because some physicians find when upon retirement that they have no identity when they're not doctoring, right? So it's important to nurture that throughout your career for many different reasons. So it's actually great that you realize that at such a early stage in your career. It's very important. Yeah. So thank you for pointing that out. There's a lot of wise coaches that speak to that. So
Yeah.
wise beyond your years.
It's funny because I was like, do I want to become a life coach? And it's like, well, I don't want my misery to become my life purpose either. Like, I
Okay,
want
right.
something good. I want something,
Yeah.
I want to do something different with, the skills that I have. And I would even go further. So, attaching your identity to who you are as a physician is, like I said, it's a huge time commitment. It really does take a big piece of who you are, but who else is there? And that like self-discovery, that's sitting with yourself, that's sitting with your family, that's family telling you like, wow, you are such an artist, or
Yeah.
wow, like that kind of is inspiring. And it's okay to have multiple avenues of fulfillment.
Yes,
Oh,
100%. Shout it from the rooftops.
dude, exactly. It's something that we need to kind of like develop ourselves. And I do a lot of reading on leadership. I do a lot of reading on self-awareness, personal growth.
Mhm.
And you really need to know yourself. So the
Mhm.
listeners out there, if you're going to walk away with one thing from this podcast or
Mhm.
this episode, know yourself, know your
Mhm.
needs, know your values, know what matters to you. It's okay if you haven't figured out your sense of purpose and fulfillment yet, but just know what brings you joy and use that as a launching point to figure out a sense of purpose. And it's okay to have multiple purposes. You
Uh-huh.
can serve
Yeah.
your family. It's okay. One fulfillment is providing for your family, providing for your patients, being, a nurturing person, being a musician, being a artist, whatever it is. It's okay to have multiple avenues of fulfillment, and to kind of, bring that as a human. In the end, you have to take care of yourself. You have to know what makes you
Right.
happy. And I find that a lot of physicians, when they're not at work, all they do is watch TV,
Mhm.
and they don't really have, like you said, they don't have a sense of self. Unfortunately, some
Right.
what happens in retirement, but there's also other people that, I'm glad, like, I'm glad that I was able to learn this early on, but that's because I experienced the burnout so early on in my career.
Right, right. Well, someone else that speaks to this is Dr. Jillian Rigger, and she has a podcast. I love the title, a YouTube channel called A Life True to You, speaking exactly to what you're talking about.
I have to check that out. I
No,
haven't heard of her, but I'm gonna
yes,
check that out.
exactly. And I can connect you if you need any help with that.
Yeah, that would be great. That'd be so
I've been
cool.
told that connecting people is my superpowers. There's someone else I'd like to connect you with. His name is Dr. Bryce Bowers. He's a resident, and he has a blog where he talks about burnout. And he's an excellent writer, and I think you're both wise beyond your years. So I'll connect you with him with Bryce as well.
Oh, I would absolutely love that.
Oh,
So, oh wow, that is pretty superpower. I will
okay.
say,
All right.
I
Um,
will say, oh,
Go
sorry.
ahead.
I was gonna say I love meeting new people, and I love advocating for this, because we're the ones in the trenches. Like, we're the ones who are actually doing the work.
Mm-hmm.
And so one thing that's very fun about me is the stereotype about pathologists, or very unique, I should say.
Mm-hmm.
A lot of pathologists are quiet.
Mm-hmm.
They just like to sit in the lab, and I am just full of energy and
Uh-huh.
super, like, I'm just a joyful person. But that's because I had to go through the negative thing, and
Yeah.
this is what I decided to make of that bad experience. This is my choice. That
Uh-huh.
being said, I think that, like, as a pathologist, I have such a unique feature in that I'm very extroverted. I'm easy to
Mm-hmm.
get along with. I love to chat. I love to connect with people. And the stereotypes about pathologists is that we're antisocial.
Right. Okay. Yeah. Yeah. No, I believe that. So actually, that leads me to. So I'm making a list of people that I can connect you with, doctors. We'll have to continue our conversation later. But one thing I wanted to say is that I feel that radiologists and pathologists are unsung heroes in cancer treatment. I also feel that they oftentimes don't receive the acknowledgement they deserve. And a couple years ago, a radiologist told me that oftentimes people don't even know they're doctors. And I was wondering if you've had that experience.
It's funny because I actually went for a a spa yesterday, and I was like, oh, I work for the hospital, and the lady was like, oh, you're a nurse, and I was like,
Hmm.
sure.
Hmm.
I don't want to, but you know, they don't even I was like, no, I work for the lab. I'm a pathologist. And I was like, oh, so you okay. I was like, I'm not even gonna explain. I don't even care anymore.
Okay.
Yes, we are, people don't even know our field exists.
Hmm.
Radiologists, pathologists, I think that we are the ones where we have to give an answer where there's a lot of uncertainty.
Hmm.
And when there's uncertainty diagnostically, oh, you send for radiology, oh, you send for pathology, that's giving them some form of certainty. And I think that when people are ill, they seek certainty.
Hmm.
And that gives them solace in, I know what's going on and I am in control.
Hmm.
Or at least I understand what's going on with me. And obviously the physician feels the same way, where it's like, okay, well, if this is the illness or this is the disease state or whatever it is, I can now treat this. It's very empowering. So I like to think of the pathologist and the radiologist as the people who empower the physician and the patient. It's just that
Hmm.
we don't really get a lot of advocacy because we have to kind of cater to the other physicians. We kind of have to work on how, you know, their flow, right?
Hmm.
So for us, it's for I'm a surgical pathologist. For me, my work is based on whatever happens in the operating room. So I have to cater to the surgeon. So what ends up happening is that because you're catering to somebody, and it's not a bad thing, we're a team. We really are a team. And I don't want to use the word catering, but
Hmm.
unfortunately, that's how the old generation looks at it. And it's like, no, 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 but like I'm providing a service to you so that you can provide a service to the patient so that we can help people heal. And I think that's kind of the reframe that we need to do in order to keep medicine healthy,
Hmm.
because right now it's very sick.
Hmm.
And I would even advocate um, that when it comes to the healthcare of healthcare, it's
Hmm.
actually in very bad shape on so many different levels.
Right.
Um, the reality is we need to stop looking at things, and this is a very hard thing for a lot of big corporations to swallow, is we need to stop looking things from a profit perspective and start looking things from a investing in people perspective.
Hmm.
And I think there will be, no, I don't think, I am 100% certain that when you reinvest in people, families, and communities, that your return on investment will be extremely significant because people are going to be well and they're going to bring their best selves to work.
Hmm.
Um, and on that note, I would actually like say like these big healthcare corporations really do need to look at physicians as things to nurture. But when I think of leadership, you really have to think of it as like that servant leader, where it's like, what am I doing to the people on the bottom to empower them,
Hmm.
make them bring them best selves to work? And that goes into corporations making policies to protect physicians, to protect the technicians. Basically, let's make policies to protect people, invest in people, make them comfortable and happy so that they can serve our higher purpose. I mean, yes, they do want to make money, and I'm totally for making money. You should make money because then you can reinvest and help other people and build communities and societies. But if the people on the bottom aren't happy, aren't fulfilled, aren't connected,
Right.
because
Right.
they're always at work or there's not enough coverage or whatever it is, then you're really setting up a system for failure. And
Right.
things are by design. We can't just
Hmm.
say like, oh, well, we've been doing this for 100 years. That needs to stop. We need to start designing things appropriately to protect people. Again, big corporations are our leaders. We really do owe these people work, but at the same time, they owe us our wellness as well.
Hmm.
They owe us to be respected as humans, and we are human capital. If
Right.
it wasn't for the people working in the trenches, these corporations wouldn't be able to exist. And we've given up so much, right?
Right.
Like medical school was 4 years, residency 4 years, fellowship 1 year. That's 9 years of my life so that
Right.
I'm able to do this job as a pathologist.
Right.
That's a lot. And I've really sacrificed, the missed birthdays, the missed whatever.
Yeah.
I really did disconnect. And
Mm-hmm.
for me, it's like, let me go into work knowing that I can still connect with other people. I
Right.
disconnected for a long time and I want to reconnect with people so that I can provide the service because I do want to help people. My mission is to help people. I became a doctor to help people,
Right.
and you as a big company are enabling me to fulfill my dream. Please protect that.
Right. No, 100%. So I just want to thank you from a patient to a pathologist because I had, cancer a few times over the last couple of years, and I fully appreciate the role that pathology and radiology had in my treatment and the success of my recovery. So I want you to know that you are appreciated, and I see you and I hear you, and I appreciate you very much.
Thank you so much. Thank you. Thank you. It means a lot. It's like you might not see us all the time, and like you said, you do see us, but other
Mhm.
patients might not see us, but we're here for you in ways that you
Exactly, right.
understand.
Exactly, yeah. So one thing I was curious about, and you've spoken a little to it, is I'm guessing you don't have patient portal messages to respond to, and that got me thinking as I'm curious about your perspective as to how your biggest pain points do and don't overlap with other physicians who regularly interact with patients, as far as like, frustrations with the EMR, loss of autonomy, things like that. If you could take a minute or two to speak to that, what you'd say.
So I'm really grateful because pathology, the work, yes, there are annoying things that we have to deal with, like billing and blah blah blah. I would say that we try to streamline our work as much as possible and try to use the EMR system. Now, EMR systems are actually smart. There are certain ones that are really good. You just have to know that the tool exists to make your work efficient. And that's what I realize is a lot of the doctors find the system annoying, not realizing that there's actually a system within the system that you can use to streamline your work. So
Mm-hmm.
pathology, actually, we like to automate what we can. And we like to any repetitive task, you like to gather it together and do it all as one. So we try to function efficiently. So if there's any new technology or something that's in the efficiency system, I know Six Sigma is big
Mm-hmm.
thing in pathology and lean and all these great things. Those are integrated in our workflow for the most part. I would like the other aspects of medicine to be able to do that. However, because patients come in with complex issues, it's very difficult to streamline. That goes down to giving people the time to be able to do that or having realistic expectations. So we try to streamline as much and try to make things as efficient as possible on our end. Obviously, it doesn't always happen. So for me, that aspect is not, it can be annoying, especially with billing and whatever, but at the same time, it's something that we have something to work with. Like there's a
Right.
light at the end of the tunnel. As far as patient interaction, I'd say I love taking care of patients from the place that I do, from the distance that I do, because I feel that when I'm around a patient, I can't help, and this is very personal, I can't help but to get emotionally connected, and that clouds my judgment.
Mm-hmm.
So for me to be able to disconnect from a patient is enabling and empowering to me to be able to make an accurate diagnosis.
Mm-hmm.
I'll be like, oh my God, this is a 32-year-old female. And this is like, is
Mm-hmm.
this breast cancer? Let me really sit with it
Mm-hmm.
for a second. I'm gonna show this to somebody,
Yeah.
like let's really take a step back and not to just, pump out an answer.
Right.
Um, so I try to be more mindful. Like I said, people, for me, I am a very empathetic person. I don't know if I fall into the category of highly sensitive individual, highly sensitive person, but for me, I do connect with people, and I think that's something that I value so much.
Mm-hmm.
Um, I do think that that's my perspective. Other people find that connection with the patient directly not as exhausting. I find it exhausting. It does
Mm-hmm.
cloud my judgment. So it's just what's best for me.
Well,
Um,
thank goodness you all have different personalities because we need all of you, right?
we
So
do.
we win. The
Absolutely.
patients win. Yeah. So as we're winding down our conversation, you did speak some to wellness. And I was going to ask you if you had any other highlights about wellness initiatives you've discovered that work, because I think we all love to hear what is actually working.
Oh, this is an interesting one. Honestly, when it comes down to, so I always like to advocate for connection. And the biggest thing is corporations, big companies, even small groups really need to look at how people are connecting in the way that they connect. Connecting with your colleagues might be more annoying than connecting with your family. And the only way that you can connect is to give people time and space and enable them, give them personal agency to do what they need to do, whether it's your yoga class, whether it's your running group, basically time outside of work. And this is just the reality. I've advocated for the 4-day work week in the past. There is some research to show that it can be effective, the 4-day work week. And I do know of certain private groups that have used that model, and it can be beneficial. I know that staffing in medicine is a current issue, at least in the laboratory as well. So that, we're not enabled with the tools today, but I think that's the vision that we need to looking forward to, especially when you've got more women in the workplace who tend to hold more of the unpaid labor at home, more of the quote unquote housework. You need to enable, and I'm not trying to be separatist or whatever, but the reality is that women do more of like the child rearing, women do more of the housework. It just is fact. And there are great men out there who are very involved. However, there is a lot of the worrying that the men don't see that the women do. So to kind of give people that personal agency, that personal space, whether it's female or male, to be able to do what they need to do, whether it's 4-day work week, whether it's 1 week on, 1 week off, whether it's whatever it is, just giving people more time to have personal agency. And honestly, they'll discover themselves too. It's just that, like I said about in the beginning of our conversation, you attach so much and you dedicate so much time to this medicine thing, and you have no sense of self.
Right.
It's so difficult to detach, and you just keep going back to work. You don't know any better. And I'm asking the physicians out there to, you want to pick up a paintbrush? You want to pick up, a guitar or whatever it is?
Yes. Whether
Just,
it's a paintbrush or a guitar. Yeah, that's
just
yeah.
do it.
Let's see. I might have to do something with that. Paintbrush or a guitar. That's great. So how can listeners get in touch with you, Alae?
Feel free to add me on LinkedIn or Instagram. I think I can share the link with you. Yeah, LinkedIn is probably the most efficient. I don't try not to check Instagram too often.
Okay.
But LinkedIn is probably the best way to get in touch with me.
Okay, well, terrific. And you can find me on LinkedIn as well, as you did.
Yeah.
So if our listeners could please click like and subscribe. I've got many more great guests to come. And thanks again for being my guest today, Alae. I'm thrilled to spotlight a pathologist. This has really you've been a delight.
Thank you so much for having me. I am so happy to be able to be that person in the field in pathology, to kind of advocate, speak, about pathology, and just kind of be a part of medicine and be, representing where I come from in the lab.
Sure. Okay. Well, thanks again. So in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.